Hi, everyone, and welcome to the Muslim Sex Podcast. I have some exciting news. I want to let all of you know that I am opening up my office, my private office, where I can see you here in New York, and it will be opening at the end of this month. So this month is now June. So at the end of this month, my office will be up and running, and I would love for you to come in and see me as a patient. So go to V Health, so that is FEMMEVIEHEALTH.com, and sign up to be a member of my concierge gynecology practice. And you can also come to see me for regular visits, or if you have a problem visit, come and see me. I, of course, focus on menopause and sexual health. So if you're having any of those issues, I'd love to see you. And make sure you come in and say hi. I'd love to meet you in person. So also, the retreat is still going on. It'll be happening September 16th through the 23rd, and we only have a few spots left. So if you were thinking about coming to the retreat where we focus on nutrition and sexual health and menopausal health, you need to register today because spots are filling up. And once it's sold out, it will be sold out and we will not be taking any more participants. So make sure you go and register for that as well. Also, as always, please remember to like and share this podcast. Leave me a 5-star review so that it shows up and so that we can get the word out about menopausal and sexual health, as well as intimacy and intimacy coaching. So if you love this podcast, please make sure to leave me a 5-star review. And now on to the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about erectile dysfunction. We're going to be talking about men today and not so much about women. Before we get into it, one thing I want to make very clear, actually two things. One is that I'm not giving any type of medical advice. So if you're having any issues, please speak with your healthcare provider. And if you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So here on with me today is Dr. Anne Truong. And Dr. Anne, please, if you could introduce yourself to the viewers and the listeners out there.
Thank you for having me on the Muslim Sex Podcast. I'm honored to be here. So I'm Dr. Anne Truong. I am been a medical doctor for like 27 years, and it's a long time, and I specialized in regenerative sexual medicine. So essentially, my objective is to educate men about sexual health and what they can do themselves to empower sexual longevity, and that I treat them through stem cell using hormones and lifestyle modification. And my passion is really to empower men and women that they can have sexual vitality for life.
Oh, that's fantastic. So tell me a little bit. I see your book in the background, and if you can tell us a little bit about your book and how you help men.
Right. So I wrote this book in 2018 called Erectile Dysfunction Fix. And again, it's really to talk about how prevalent erectile dysfunction is and why. And that to educate men that don't have to take medication if they have ED. There are other alternative treatment such as lifestyle modification like diet, exercise, stress management, and sleep, and just simply getting blood work to look at their testosterone level. And that if their erectile dysfunction is more severe, that they're not responding to those measures, the next step is to use their own stem cell, which is in their blood, called platelets. Those are the little cells that are in your red blood cell that help you heal. And then also adding that with technology such as shockwave therapy, which uses the technology of sound wave to help heal tissues and bring in more blood flow. And then our approach is really multimodality, meaning using multiple approaches to restore blood flow and functioning again. So that way, a man can get more blood flow, to be able to perform. So I'm a big proponent of being, proactive about a disease or a problem rather than reactive, right? So, meaning with your sexual health, I want men and women to think about sexual health like brushing their teeth. Like we brush our teeth, we floss every day. Well, there are things that we can do for our sexual organ, our sexual health to maintain it. So that book stresses mainly lifestyle factors and preventative measures, as well as things that you can do now, no matter whether you're 30 or 20 or 80 years old, to really preserve your sexual function, because your sexual function is like your teeth. You don't take care of it, it's not going to be there by the time you get older, and it's going to have issues. And if you know what to do with it, we may not have a high prevalence of erectile dysfunction. We know that 50% of men over 50 have ED, 60% of men over 60 have ED, and 70% of men over 70 have ED. And it's sad because really the prime of our life is like really after 50, right? And that's when the kids are out of the house and you're financially more stable and spend more time with your partner, or you're dating at that time if you're divorced. And if your sexual functioning is not as optimal level, then it's kind of, not where you want to be, right? So, but unfortunately, that's when sexual functioning really needs a lot of TLC care from the man to maintain it to function. A lot of men don't realize that there are ways that they can do to maintain their sexual function other than taking Viagra or Cialis.
Okay. So, what I find interesting is that, you talk about erectile dysfunction, and then you mention doing PRP, right? That's basically what you're doing. You're injecting stem cells into, I would assume, the penis to help with erectile dysfunction. And then you also talk about, maintaining lifestyle and quality of life. So, I know that some urologists that I've spoken to in the past actually have stated that, when an individual has issues with erections, that really is a canary in the coal mine, and actually that there's, perhaps some cardiovascular disease there that they really need to get evaluated. So, what are your thoughts on that?
Absolutely. Yeah, absolutely. A man's sexual organ, his penis, his barometer, is his red light engine. So when he has ED, and the first symptom presentation of ED is that he's able to get an erection, but he loses the firmness of that erection. That's the first presentation of that. And unfortunately, when that is the case, Viagra doesn't actually help in those scenarios, but that presents it as venous leak. Venous leak meaning that the veins are not completely compressed during erection. So to answer your question, is that when he notices that should be a red light thing, because we know that if a man has ED, 7 to 10 years down the road, 67% of them end up having a heart attack, or even progress to even having a stroke. And unfortunately, I see that in the men that I treat. A third of them will come and see me with ED, and they already had either a heart attack or a stroke. 67%, so 2/3 of men that have ED will progress that way if they keep popping that ED pill. Because when you take Viagra and Cialis or the ED pills, it's really, you're just ignoring the cause of why you have ED, and you're just putting a Band-Aid on it because it works for a little while, but the cause of why a man has ED has not been addressed, which is really due to poor blood flow. Poor blood flow can be contributed by high blood pressure, high cholesterol, diabetes, stress, sleep, cigarettes, nicotine, and even marijuana as well too. And as you know, those are all factors that contribute to heart disease, stroke as well too. So there's a lot of common risk factors of between ED and heart disease, because all those factors that I mentioned are risk factors for heart attack as well too. So that is no wonder that 67% of men 7 to 10 years down the road end up having a heart attack. It could even be fatal. Not just a heart attack you survive. It could even affect your mortality as well too.
Sure. So I'm curious to know. So we know that the biggest sexual organ is actually the brain, right? So if the brain is not into whatever it is doing, it's, that body part may not be performing as well. So I'm curious to find out, what you think about really dealing with the psychological component of this first before you start getting into all this other stuff. Because really, I think what's important to realize is that, the brain, not only does it control the physiological aspects of what is going on, but also, if a person is having problems with, let's say, is having performance anxiety, or if they think that their partner is, not into them, or if they're, they have so many things going on in their head that no matter what you do to their, let's say their penis, it's not really going to help if they're cognitively thinking about so many other things, and they're also thinking, having performance anxiety, and they're like, they're worrying about their erection and all this stuff. I think that it's just not going to work. So tell me what you think.
Oh, absolutely. I'm 100% on board with that. And honestly, I have seen men at, at 30 years old, totally healthy, no risk factor, no medical condition, and would have ED like literally within a week, and then take Viagra and doesn't even help with that because he, the problem is really more a performance anxiety problem because it's in his head. And because anytime you have ED and it's sudden, it's a short span, because ED takes years to present. It could take between 1 to 3 years, but all of a sudden you're performing well, and a month later or a week later, you're not able to have an erection. It's most likely due to you overthinking it in your head. It's kind of like getting in your way, or in other words, performance anxiety. I'm not a great proponent of saying the word performance anxiety, because performance to me is like you have to be perfect perform. I call it more of, kind of getting in your head and just, distracting it in your head. And like you said, the brain is a larger sexual organ, and everything starts in the brain. And I would tell my patient that, think of it first, because I see that presentation in my patient, that I'm able to restore function and blood flow to their sexual organ, but they're still stuck in their head, as in like, oh, I meet this lady, and I can't get it an erection. It's because he's thinking about it too much, because the sexual response or the erection really start in the brain, because your 5 senses feed information to the brain, and from the brain, hormones is released, nerve transmission is released to stimulate the increasing blood flow that really starts from the heart. So the 5 senses is, touch, smell, taste, and hearing, and visual. And oftentimes I tell the men, I said, tap into your senses that you have, into that. Clear your mind. Don't think about what you're going to do tonight, tomorrow, or anything. Be in the moment. Let the 5 senses absorb into your brain. Be in the moment. Let yourself feel young again. Let yourself enjoy the moment, what it's like to feel excited, aroused, because arousals, again, start in the brain as well, too. And once all those messages are relayed in the brain, then the hormones start to release from, the pituitary gland and going down the nerve. And then the nerve goes to the heart to increase the heart rate, and then therefore more blood flow that can bring more blood down to the penis. And so everything starts in the brain. I know that if even though I got a guy functioning really well, with blood flow down there, if he's still in his head, nothing is going to work. Even taking medication, isn't going to work. So oftentimes, but I would tell you, oftentimes if he gets positive reinforcement that, hey, I'm able to get a morning wood because, well, when you have a morning erection, when is that? When you're asleep, when you're relaxed, and usually when you're dreaming. So nothing is in your head distracting you. So I would tell a man that you're having morning wood, you should be able to function fine. And you're having morning wood because your mind is not distracted with other things and you're not overly thinking about it. So that tells you that, hey, you're ready to go, there's nothing wrong with you. And, so I stress that a lot. I stress, using the five senses, being in the moment. And it takes practice because, what Viagra and Cialis does is it becomes a crutch for a man after using it for a while. And I would tell you that most of the men that use it do not tell their partner. Do not tell their partner that they're using it. And most men don't even tell their partner they even have ED sometimes. And the women sometimes knows that he has ED but doesn't acknowledge it because she doesn't want to hurt his feeling, to hurt his ego, his integrity. So it's an issue that both parties is aware of it, but nobody's talking to each other. It's a very sensitive issue as well. And he's taking medication and probably trying other stuff. About 25% of the men that come in and see me tell me, "Wow, my wife doesn't know anything about this, or my girl doesn't know anything about this. I just want to get this fixed so, we can have a good sex life." So it's a very sensitive issue, but the brain is the largest sexual organ, and I stress that almost with every patient that I see.
Yeah. Yeah. I mean, I think that, what you're saying, there's so much there. Similar to that, with women, I think there's a lot of issues with body image that, women have. They start to spectator. And I tell them to use the same thing, to kind of get into the moment, to use mindfulness. There's been lots of studies and I had Dr. Lori Brado on, that's a psychologist that actually wrote a book called Better Sex Through Mindfulness. And she was on my podcast and she talked about being mindful. And that's basically, what you're saying with getting in tune with your senses, right? You're saying be present in the moment without judgment. And that's all mindfulness is. And she's also published studies that have shown that when women specifically, because her research is on female function and female sexual health, and what she said is that when women practiced mindfulness in a group therapy session and practiced 90-minute sessions, that within 6 months, they noted increased lubrication, arousal, and libido through mindfulness, through this whole just basically getting into the senses and really appreciating that. And also there's another, she's a sex therapist. Her name is Linda Weiner. And she was also on my podcast. And she actually talks about a modality that they use in sex therapy called sensate focus. And sensate focus is similar to that, where again, you're using your senses, mostly touch though, and you're feeling for the texture, the pressure, and really how does the person's skin feel under your hands. And again, it's a form of mindfulness that you're using to really be in the moment, so that you are not worried about all the chores that you have to do, worried about whatever your partner is thinking, worried about, the bills and this and that, your office, whatever. Instead, you're just really focused in on the moment and what you're doing at that time to really increase that libido and that arousal, such that you can have, the sexual health or the sexual experience that you're really looking for.
Yeah, absolutely. And it's often sometimes just getting into the moment, and then you can become more aroused while during the act. So most people think that they have to be aroused and all that to get started, but sometimes you get more aroused as you start doing foreplays and get into the act, and it just kind of goes. That's one of the reasons why I recommend for my listeners and my patient. We have a coaching program that oftentimes just kind of like fantasy, just kind of like you imagine what would be like, and that will get you into the moment as well too. And you know, if you're married, you have a long time partner, is to do to try new things. You know, instead you go instead of in the house, you'll do it. You know, you go to a hotel or go on small trip to add excitement to the relationship again. And that interesting, you know, after we're having you know, worked with over 7,000 men with their sexual health, it doesn't take a lot for a guy to get in his head about his sexual performance. Oftentimes is from maybe 3 to 5 times. And then he start overthinking it. It's like if he get together with a partner and he loses his erection, he'll be like, oh, okay. But then he internalized that. And it only takes 3 to 5 times. Imagine if you do something 3, 5 times, sometimes even 2. He's like, oh my God. He's thinking, oh, next time he's with the same partner or another partner, you know, it's just going to happen again. So when you start thinking about that in your head, it actually will distract you from being in the moment. And I'm just really surprised that sometimes it takes like 2 times with the same woman. And he's thinking about it again. So and that would distract him from in the moment as well. It's kind of like, you know, when you and I would take a test for our board or something, and, you know, maybe one test, and then, you know, we're going in there and thinking, oh my God, you know, I hope I won't fail. There's almost like a setup for failure if you're thinking about that to distract you on it. I'm always telling men to reassure them that, you know, a few times it isn't going to be a reflection of your, you know, that you actually have ED, that, you know, it takes a while to get ED, but the brain plays tricks on you. You start thinking about it and it gets worse and it gets worse, become a kind of a backward spiral that, you know, affect the physical functioning, because when the anxiety starts, the stress starts to release, the stress hormone gets released, that will affect the hormone. And then when stress happens, that causes inflammation in the lining of the blood vessels that then affect the blood flow. So really, if you start in the brain, it's going to become physical over time if it lasts for a long time. Meaning I would say probably like over years. But one of the most difficult issues that we deal with is, and I would tell that having treated so many men, the physical rejuvenation to get more blood flow to the penis is actually easier than the treatment for the what's going in his head, and getting him out of his way as well. Because oftentimes some of them, you know, they work out well. They have morning wood, and if they have erection, if they're by themselves, but when they're with a partner, they don't have erection, and they still rely on taking Viagra or Cialis to help them with the erection. It always become like a crutch.
Yeah, I mean, I would think that, you know, there's so much of the psychological component of it, right? And I think that once people have in their head that they have some type of sexual dysfunction, I think it's hard to, you know, and if then they see that over and over again, that they're not able to perform or whatever, right? They're not able to maintain an erection, then I think that, like you said, becomes a self-fulfilling prophecy. And then you're not able to move past that. And that's where really like coaching comes in, because like you said, you know, you really have to help the patients move out of their own way, right? They're holding themselves back because they keep having these ruminating thoughts that what if this doesn't work? What if this is, you know, going to happen again? What if this, what if that, blah, blah. And then all of a sudden now this problem that, like you said, perhaps happened, you know, once or twice, now is going to continuously happen because they're so focused on it happening that it actually happens.
Yeah, it's kind of weird, you know. You focus on that, you worry about it, and then it becomes a reality. But
Yeah.
But that can definitely fixed and treated with the right therapy, and so I'm glad there are choices out there for men and women to rely. I often advise men to go to therapy with their partner or wife because it's really ED is a two-person problem too. It's not just the man problem, because the women are also it's not that they're out of the problem, but it's a couple scenario where we know from studies that a man with ED, without doing anything, if he has a supportive partner that supports him mentally and psychologically and physically as well, that she becomes a big part of the treatment of his ED progression. I mean, of his sexual functioning improvement. That's what I mean. That she herself is also a treatment as well. And then conversely, if she is not supportive, then that will also impact upon a man's sexual functioning as well too.
Yeah, I mean, I think that if the partner is not supportive of the patient, then perhaps they need to get a new partner, right? Because I
Yeah.
think that that's causing a lot of the problem, causing a lot of the dysfunction, right? Maybe there's resentment there, maybe there's anger, maybe there's maybe there's, pornography use, maybe there's all these other things going on that then are also adding and contributing to the problem. And, perhaps it just makes the relationship worse. At what point do you suggest, I know you mentioned couples therapy. And so I'm curious to find out at what point you recommend like a sex therapist. Like, I think that sex therapists are fantastic, especially for something that, you're doing. And I think that whether or not somebody that comes in with a sexual dysfunction realizes it or not, I think that they could probably benefit from a sex therapist, right?
Well, absolutely. Honestly, if I think if a man or woman start to seek help with a physician regarding his or her sexual function, it's a good time to seek that sex therapy. There is for me, it's like any time, because I feel that's an important part of the healing process. Mind and body, not just the body alone, mind and body. So I have sex therapists locally that I refer patient to, and also nationally as well. I always make that a part of my treatment plan, because now you can see them virtually as well. Insurance covers it, and most of them can take it almost costs as much as probably even going to see a personal trainer. I stress that. So the beginning as much as possible, and I feel that if they do sex therapy, that will shorten their duration of how long it takes for a man to improve, because we know that a supportive partner and sex therapy is a big contributor to the healing process with a man with ED. And I think it's probably even up to 65%, and the other 35% is physical. Because I see that. I honestly see that in my patient. Yeah, oftentimes, like I said, I would have like a 26-year-old say, I have ED. There's something wrong with me. I can't perform with at least 3 women. And I would examine him and do his blood work, and I also do an ultrasound, a Doppler, ultrasound of his penis to look at his blood flow. And is there any, scar tissue or anything like that? When it's normal, and I just tell him, you're great. Everything is working fine. Just getting up, reassure him. The next day, he's like, oh, I'm fine. I'm great. I'm able to get my erection, again, because, in his mind, he's thinking, all right, there's nothing wrong with me now that I see a doctor. I'm functioning well. So I'm fine. But the mind is so powerful in that, if you think you have ED, even taking Viagra or Cialis doesn't even help you.
Right.
Even. Yeah, that's how powerful the mind is. And I see that more often than not, actually, in younger men who get into their head and think that they have ED, and they take, like, I'm talking about like higher dose, like 100 milligram of Viagra and see nothing. I'm just like really just astonished at how the brain can really suppress the effect of the medication.
Yeah, I mean, absolutely, right? We know that the brain just controls so much, and that's so true with women as well. They're, when they're so into their head, they are not able to enjoy what they're doing. They're not able to orgasm. They're not able to experience arousal or desire because they're so into their head. So I would assume it's the same for men as well.
Absolutely. Yeah.
So, for somebody that's watching this and thinking like, wow, I really need to go see Dr. Ann Truong, how can they get in touch with you? How can they work with you?
Yeah, so the best way, honestly, is to go on our website. My website is truongrehab.com, TRUONGREHAB, and then we have a live chat right on that website. You can contact us then, and we have somebody that can respond to you. We offer a discovery call that we discuss with the customer about what's going on, and we will not offer you treatment unless we feel that we can help you. And so I'm a big proponent of that. We also have an online coaching program where because I know that, I'm in Virginia, not everybody can come to see me, in Virginia. And we have an online coaching program where we have, members all over the world, Nigeria, New Zealand, and England, that are part of our community, where I go live and I coach men twice a month. And answer their questions. And it's kind of like me giving you, a quick, roadmap on what you need to do to restore your sexual functioning again, because I feel that education is big in sexual function. And it's not out there. There's a lot of junk out there, misinformation out there on the internet when you Google stuff, because you're going to go down a rabbit hole of taking this supplement to help this, doing this to help. Because oftentimes I always tell men, you got to fix your foundation first as well. What's foundation? Your body, the functioning of your general health, first, which is diet, exercise, and sleep. And if you fix that first, then you can take that supplement or whatever, because if your body's not doing well, whatever supplement you take or whatever medicine you take, it isn't going to function well, because your foundation is not going to be able to process that. So I often deter men from taking this supplement for their libido, the desire, and anything. I would stress the lifestyle modification first. So we have the community of coaching men called the Modern Man Club, and they can go to the URL noedman.com to find out more about our online coaching community and how to get out of ED, without medication and without going to see the doctor sometime, because I feel that some of the strategies that we give men to implement, and if they do it now, like when they're in the 30s, 40s, even 50s, will go a long way later on, because ED is kind of like weight loss. If you work hard to lose the weight or to restore your functioning again, you still need to continue those good habits of diet, exercise, sleep, and stress management in order to maintain the sexual function or the weight loss, right? Because if you don't, you fall off the bandwagon, your weight will come back, or then ED will come back as well. So as in everything, if you're getting good results, stay with it. And it will be maintained, because we're seeing men that have ED for like a decade join our community of coaching program. And just by changing their diet, just by sleeping more at night, and stopping smoking cigarettes, they're just by doing that, they're able to restore their erection again. And we have many men with testimonies that feel that they're restoring their function with just doing the basic lifestyle changes.
Yeah, I mean, that's, that just proves how powerful lifestyle is and working on your brain health as well, right? And we know that getting adequate sleep throughout your day is very important. It decreases the stress levels in your body, right? So trying to manage stress, that also really helps with your cognitive function. So really important. Well, that is fantastic. And I'm sure people can go online and purchase your book as well, the one that you have behind you, right?
Right. It's on Amazon. Is on Amazon. You just type in erectile dysfunction fix, or my name, and Truong, Truong, and it will show up. It's, been there since 2018. It probably needs a second edition, since then. And I just haven't had time to do that, at this point, but focusing on really education. And education is my main, passion on sexual health for men and women. I don't feel that I just address men alone, because I think a lot of what I educate men for can also be for women as well, too. And one thing I want to say is that I treat a lot of men. I treat more men than women on sexual health. And I will tell you, the men, when they have ED, 99% of them do not say it come because do not blame the women or anything like that. They want to please their women, their partner. They take up all the blame because they blame themselves for having ED. But conversely, sometimes I'll see women that are partners of men of ED. The women blame themselves for causing their husband or their partner to have ED, because the women feel that, oh, I'm not attractive to him. I'm not arousing him like I used to. That's why he's not able to get an erection. And the man is saying, oh my God, I really want to please her. And I love her so much. I want her to enjoy the experience, and I can't get a firm erection. What is wrong with me? So it's like they're blaming themselves for, at that point, but nobody's talking to each other. But I can tell you, with having treated over 7,000 men, the narrative is that it's not their partner, and the men is overthinking it. They're blaming themselves, and oftentimes they're like, oh my God, what did I do wrong? They blame themselves because they did something wrong to cause them to have the ED. And my position is that, you don't know what you don't know. So we are going to be, you and I are going to be providing the education for men and women, on ways that they can have sexual vitality, longevity for life, and even just making small changes will go a long way.
All right. Well, thank you. Thank you so much for all of this information and for helping all these individuals that I'm sure are probably really hesitant to come out and seek help. But, once they do, I'm sure they're probably really happy that they did. So I'm glad you provide that service for them. So, well, we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So if you're having any issues, such as erectile dysfunction, make sure you go and speak with your healthcare provider that can provide you with insights and examinations, and then provide you with resources as well. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.